What if I told you that some of the earliest public health practices we use today can be traced back over 3,000 years to the Bible? Long before microscopes, vaccines, and modern medicine, the Bible recorded detailed instructions to prevent the spread of diseases. These instructions were remarkably practical. Some of them mirror what modern science has discovered about epidemiology, the study of how diseases spread and how to control them. Epidemiology plays a key role in understanding pandemics and saving lives. From tracking diseases to implementing measures like isolation and sanitation, its goal is to protect populations from outbreaks. But what does this have to do with the Bible? A lot more than you might think. The Bible may not be a medical textbook, but its wisdom about plagues, hygiene, and disease prevention aligns in fascinating ways with modern public health principles. The most famous example comes from the book of Exodus, where the Bible describes the 10 plagues of Egypt. These plagues devastated the land, causing environmental chaos, illness, and suffering. The water of the Nile turned to blood, fish died, and foul odors polluted the air. Frogs swarmed homes and towns. Disease struck livestock, and then humans broke out in boils. Locusts ravaged crops while darkness covered the land. Some of these plagues have been analyzed through a scientific lens. Contaminated water, for example, could have caused mass deaths among fish. Without clean water, bacteria would spread to humans and animals, triggering widespread disease. Modern outbreaks like cholera demonstrate how poor water sanitation can lead to cascading public health disasters. Though the Bible describes the plagues as acts of God, they also show how environmental changes and hygiene failures can unleash disease on a massive scale. The Bible's teachings about leprosy offer another striking connection to modern public health. In ancient Israel, people with leprosy were considered unclean. The book of Leviticus outlines specific rules for identifying and isolating those with infectious diseases. Anyone showing symptoms of leprosy was to live outside the camp, away from others, and cry out unclean whenever someone approached. This wasn't just a religious command. It was an effective public health measure to contain contagious illnesses. Isolation is still one of the most critical tools in epidemiology. During outbreaks of diseases like tuberculosis, Ebola, and COVID-19, quarantine prevents infections from spreading to the wider population. Without understanding bacteria or viruses, ancient communities followed principles that modern science would later formalize. Leviticus doesn't stop with isolation. It also emphasizes hygiene. The text commands that people wash themselves and their clothes after contact with anything unclean. It also advises the burning of contaminated items to prevent further spread. Human waste was to be disposed of far from living areas. These rules were practical. They reduced the risk of infections spreading among the Israelites, who lived in close quarters during their time in the wilderness. Today, we know that bacteria and viruses thrive in dirty environments. Contaminated surfaces and poor waste management are breeding grounds for diseases like dysentery and cholera. Something as simple as washing hands can dramatically reduce infections. The Bible's emphasis on cleanliness wasn't just spiritual symbolism. It provided essential protection against disease outbreaks at a time when medical knowledge was limited. What makes this even more remarkable is that the instructions given in Leviticus resemble key principles in modern infection control. Epidemiologists stress the importance of hygiene, disinfection, and isolation as cornerstones of public health. These measures, seen as common sense today, were groundbreaking for ancient societies. The priests of Israel served a dual role as spiritual leaders and health inspectors. They were responsible for diagnosing diseases, enforcing isolation, and declaring individuals clean or unclean. Leviticus describes how priests would inspect skin conditions, monitor symptoms, and determine whether a person posed a risk to the community. If someone recovered, the priest oversaw their reintegration through ceremonial cleansing and sacrifice. In a way, these priests functioned like the world's first public health officials. They observed symptoms, tracked cases, and ensured that disease did not spread unchecked. Though they lacked modern medical tools, their approach reflected an early understanding of contagion and containment. The Bible also includes broader lessons about disease prevention through environmental care and community responsibility. In the book of Numbers, the Israelites are instructed to keep their camps clean and orderly. Human waste must be buried outside living areas to maintain sanitation. These instructions were not just practical. They were essential for survival in the wilderness, where poor sanitation could quickly trigger deadly outbreaks. In many ways, biblical principles of health align with the scientific discoveries of germ theory, which emerged in the 19th century. Germ theory revealed that microscopic organisms like bacteria and viruses cause disease. But thousands of years before this discovery, biblical laws laid out strategies to prevent infections from spreading. These strategies were based on careful observations of how diseases moved through communities. Consider the impact of modern hygiene campaigns on global health. Hand washing, clean water supplies, and proper sanitation have saved millions of lives worldwide. These same principles are embedded in biblical laws about washing, isolation, and cleanliness. The Bible may not explain the science behind germs, but its wisdom anticipated their consequences. The connection between biblical wisdom and modern science is not a coincidence. Both aim to protect human life and promote health. Biblical texts reflect an understanding of disease patterns based on experience and observation. Modern epidemiology builds on that foundation with tools like microscopes, vaccines, and data analysis. This does not mean that the Bible replaces scientific knowledge. Instead, it shows how practical wisdom about health and disease has been passed down through history. The Bible's accounts of plagues, hygiene laws, and isolation reveal a deep concern for community health. They demonstrate that caring for others includes preventing harm and protecting the vulnerable. Today, public health officials use advanced tools to track and contain diseases. Satellite maps, genetic sequencing, and global data networks give us a level of understanding that ancient societies could not have imagined. Yet some of the core principles, quarantine, hygiene, and environmental care, remain unchanged. They are as relevant now as they were 3,000 years ago. The Bible also reminds us of the human side of disease. Plagues and illnesses are not just statistics. They disrupt families, communities, and lives. The stories of those who suffered from leprosy show how isolation, though necessary, can bring loneliness and despair. In the New Testament, we see Jesus breaking social norms to heal lepers and restore their place in society. These stories highlight the importance of compassion alongside prevention. Public health is not just about stopping disease. It is about caring for people. It is about creating environments where communities can thrive. The Bible's teachings offer a holistic perspective that balances physical, emotional, and spiritual health. When we look at biblical accounts through the lens of modern science, we see an impressive overlap between ancient practices and modern principles. The Bible's focus on isolation, hygiene, and environmental care reflects timeless truths about how to protect human health. As we face challenges like pandemics, antibiotic resistance, and emerging diseases, we are reminded that the fight against illness is as old as humanity itself. The wisdom of the past can still guide us toward solutions for the future. The Bible may not have used words like bacteria, viruses, or epidemiology, but it understood the importance of preventing disease. Its health laws saved lives in ancient times, just as public health measures save lives today. When you hear about quarantine, hand washing, or sanitation, consider this. These practices are not new. They are part of a long tradition of wisdom passed down through generations. They remind us that human health depends on shared responsibility, care for the vulnerable, and respect for the environments in which we live. The Bible's contributions to public health are a fascinating example of how ancient wisdom and modern science can intersect. They show that the search for health and wholeness is a journey that spans thousands of years. And in that journey, the lessons of the past continue to light the way forward. By combining ancient insights with modern knowledge, we can build healthier, safer communities. The Bible's message is clear. Protecting life matters. Preventing harm matters. And caring for others is a responsibility we all share. The next time you wash your hands, hear about a quarantine, or think about public health, remember this. Some of the foundations of epidemiology are far older and far wiser than we often realize.